At the moment in hospital, we rely on paper-based records. We have done for many, many years. Those records are often written specifically for one practitioner as a record of their consultation. In hospital practice, they can also be written as a means of communication to try and tell others what's going on. But as you know from your own records, if you've been an inpatient, they can be huge. And what we tend to do is to look at the bits that are easiest to find, not necessarily the detail that we need to see. And then we ask you, the patient, all of the same questions again, just to confirm that we got it right, particularly if we can't read the handwriting. The other aspect of paper records is they can only be in one place at one time, and that is often not where you are. So, at outpatients, in the emergency department, on the wards, your notes will be somewhere else. The notes can't necessarily be updated in real time unless I, as a clinician, have them in front of me, and that means I'm denying someone else have them in front of them. So they can't be looked at and read simultaneously by different people in different places. Electronic notes get us round all of that. As soon as I've typed it in, everyone who needs to read it can read it. I'm reminded of a patient who came to see me about 2 weeks ago, a young man with a swollen side to his face, swollen jaw, possibly due to a tooth abscess. He'd seen a dentist, an out-of-hours GP, his own GP, and an emergency department, and came to us armed with a carrier bag of different and dangerously incompatible medicines that all those different people had prescribed for him. All with the best will in the world, all trying to do the right thing by him, but he hadn't been able to remember what he'd been on for each new person. And he came to me and said, "What do I do with this?" To which the answer was throw much of it away and get the treatment right first time. If each of us had been able to see the full record of where he'd been up till now and what he'd been given by each different person, we would have coordinated his care. We would have appreciated how his needs from the health service were escalating from day to day, and we'd have got his treatment right the first time.